Welcome back. We're still on the topic neurobiological theories and psychopharmacology. Let's go over what we learned in the previous lesson. We learned that the brain is the control center for thoughts, emotions, and behavior. 2. Different brain regions like the frontal, temporal, parietal, and occipital lobes have specific functions. Lastly, when there is damage or dysfunction in any brain area, it can lead to changes in behavior and mental health conditions. And by the end of this lesson, you will be able to 1. Identify major neurotransmitters and describe their functions in the brain. 2. Explain how imbalances in neurotransmitters contribute to mental health disorders. Alright, let's now look at what neurotransmitters are. Neurotransmitters are chemical messengers that carry signals between brain cells. The imbalance can contribute to mental illness. We will now explore the brain's chemical messengers, what they do, and the impact of an imbalance. First, the serotonin. It is called the feel-good chemical, and it regulates mood, sleep, and appetite. Now to the imbalance of serotonin. Low levels of serotonin are often linked to feelings of sadness, anxiety, and a lack of interest in things you once enjoyed, a key symptom of depression. Next is the dopamine. This is the brain's reward and motivation chemical. It is involved in motivation, pleasure, and reward. It's why you feel good when you achieve a goal. We will now explore the imbalance of dopamine. 1. Too much dopamine can lead to psychosis, a state where a person loses touch with reality and experiences hallucinations or delusions. 2. Too little dopamine can cause a lack of motivation and movement difficulties, similar to what's seen in Parkinson's disease. Continuing, we will look at the next neurotransmitter, the norepinephrine. Norepinephrine is a neurotransmitter that plays a crucial role in the body's stress response. It helps regulate alertness, arousal, and attention. Think of it as the brain's natural alarm system, preparing the body for action in response to a perceived threat. Let's take it a step further and see the imbalance of norepinephrine. An imbalance in norepinephrine levels can have a significant impact on mental health. 1. High levels are associated with anxiety, panic attacks, and hypervigilance, which is an exaggerated state of being on guard. 2. Low levels can contribute to a lack of energy, difficulty concentrating, and can be a factor in depression. Now, here is a clinical example. A patient with severe anxiety might describe feeling on edge all the time, unable to relax, and experiencing physical symptoms like a racing heart. A part of this is due to an overactive norepinephrine system, which keeps their body in a constant state of fight or flight, even when there is no real danger. Many antidepressants, like SNRIs, also known as serotonin norepinephrine reuptake inhibitors, work by balancing both serotonin and norepinephrine to improve mood and reduce anxiety. We are going to wrap this section up and continue in the next lesson. Let's recall our memory to what we have done. 1. Neurotransmitters are chemical messengers that affect mood, behavior, and mental processes, with serotonin linked to mood and depression. Next, dopamine controls reward and motivation, where too much can cause psychosis and too little can lead to low motivation or movement issues. And then, norepinephrine regulates alertness and stress response, with imbalances contributing to anxiety or low energy and depression. That is it for this session. Thanks for watching. See you in our next video.